Здравейте, уважаеми зрители! Първата конференция, посветена на детското клинично хранене, се проведе във Варна. В нея взеха участие много специалисти от цялата страна в областта на клиничното хранене, както и представители на ЕСПЕГАН – Европейското дружество по детска гастроентерология, хепатология и хранене. Конференцията беше организирана в рамките на дейностите на проекта за повишаване на транслационните постижения в медицината МУВЕТИМ. Нека да видим.
Уважаеми колеги, за мен е истинско удоволствие да открия конференцията по детско клинично хранене, която провеждаме за първи път във Варна, а мисля и в нашата страна. За нас е чест да бъдем заедно с представителите на ЕСПЕГАН, Европейското дружество по детска гастроентерология, хепатология и хранене. Това е организацията, която от десетилетия вдъхновява клиницистите по света да повишават стандартите в грижата за децата.
I'm a pediatric gastroenterologist from Cologne, Germany, and within ESPEGAN, so the European Society for Pediatric Gastroenterology, Hepatology and Nutrition, I'm the education secretary, and in this function it's an honor for me to be here to take part in this ESPEGAN-supported educational event, I would say.
Is this your first time here in Varna?
Actually, it is. Yeah.
How do you feel?
Very good. Very hospitable surrounding.
What is your topic and what are the challenges of your daily work?
So actually the topic of my talk will be on specialized diets within pediatric gastroenterology, and so I'm confronted with specialized diets daily in my daily practice, because I see a lot of patients with nutritional challenges, and I want to share my knowledge with colleagues here. 10-20 years ago we saw a lot of malnourished children, but malnutrition in the sense of being underweight. And nowadays we probably also see malnourished children, but with a normal or even increased body weight. So the spectrum has changed, and so that's why the topic stays very interesting. A lot of countries have this tendency, and some sooner or later. I would say where I come from, Germany, is probably in the middle. There are countries where we see this wave of obesity in a higher degree, countries probably in the Mediterranean area where it is lower, but we see this tendency to malnutrition and obesity all over Europe, I would say. The parents in my clinic ask me very frequently, how should I feed my child? And so we have to do very basic teaching, and of course they can use the internet, but I think the contact from patient to dietitian and patient to doctor is very important to teach the eating styles.
You mentioned the internet, and my last question is about it. How do you feel about all these sites and platforms where we can go easily and find some type of diet or nutrition program, and it's very easy to start and to get a big mess with your health?
Yeah, you're very, very correct, and very good question. So the barrier is very low to find lots of information in the internet, and I think it's our task as healthcare professionals to guide the parents. So the parents and families, they will go on the internet automatically, because that's what everybody does. But we have to guide them and tell them what are the good internet sites. If you use ChatGPT, be very careful and filter the information and ask us for guidance. So we need to stay in very lively communication with our families to guide them through the internet and the social media. But I think the social media is very important, and will even get more important. And there are good sites, good TikTok videos, but we have to guide our families.
I keep collaborating, of course, with the team here. So we have a couple of studies, and most of them are looking at the nutritional status of children with chronic disease, mostly in children with inflammatory bowel disease. So with Russia and the team here, we are trying to understand how the nutritional status and growth of children with inflammatory bowel disease changes over time. So this is a pan-European project. So we've got almost 9 different countries, and we've got approximately 100 children that we kind of like observe over time. The other big project that the team here has been involved is looking at development of new nutrition risk scores for children with inflammatory bowel disease. We call this new screening tool the PIBD NUTS, okay? And of course the team here is participating alongside 52 other sites across the world. I gave a talk yesterday about how to assess nutritional risk in sick children. So that was one of my first talk, and the second talk was to understand how we can actually treat active Crohn's disease and ulcerative colitis using dietary therapies. There's a lot of bureaucracy these days about how to do clinical research, a lot of issues about research governance, issues, a lot of what we call red tape, but we persevere, and the aim of our research is essentially to improve the way by which we treat children with chronic diseases using food.
And how do you professionals, specialists in healthcare, feel about the new digital devices as ChatGPT and the other AI applications that a lot of parents use for health?
Yeah. So yes, that's a very good question. I'm not sure I've got a very good answer. I think AI will be with us for the rest of our lives, so I don't think we have to avoid it necessarily. I think we have to learn how to live with it. Some of these AI devices or social media or platforms can help inform patients on how to go about nutritional advice, but I guess the gold standard remains the human, so it's very important for parents to get informed advice from their healthcare professionals.
The past year has been great. I've been working a lot with Rusa. We're together at the Committee of Nutrition now of ESPGHAN. So the projects that we're doing together is now broader than just the neurologically impaired children. But one of the projects that we are starting now is on a survey that we're doing amongst parents, questioning them how they feel about a G-tube, so having gastrostomies in place, what information they would like to have, what their fears are, what they expect as a benefit. And it's a project that we're doing in different countries through the malnutrition group of ESPGHAN as well. We have over 20 centers already that want to participate. So I think it will be actually a great project, and it will really help us understand what parents fear and what they think about it, and it will help us counsel them better in different countries as different countries are participating. Biggest challenges on a personal level is a lack of time, like everybody, I guess, in healthcare. And then with the projects, it's not an easy question. I would say that there's still some barriers in place regarding this need for proper nutritional assessment. I don't think that the awareness is there yet in every healthcare professional that deals with children with neurological impairment. It is growing, but we still have lots of work to do to show them the data. That's also why the project that is currently ongoing with the Nutrilect project is so important, to show them data, to show people this really matters, what we're doing, the problems are there, and we need to improve it for children. Sometimes we underestimate the burden that these parents have to carry already, because it's good, and I'm 100% convinced we have to prevent problems, and preventative medicine is better than curative medicine. but these children already have so many problems there. So sometimes parents are overloaded, and we especially see it during winter times when they get sick even more often, and so they get hospitalized quite frequently, more than just healthy children. And so they already have to come so many times to the hospital, and then when you make them come another time for some problem that might arise in the future, we see the same thing, that sometimes parents don't show up or they cancel the appointments at the last time. The way that we deal with it is we try to, but it's not always possible, obviously, is we try to group the consultation as much as possible on the same day. So if parents have to come, because sometimes they have to travel, if you have to travel with a child in a wheelchair, it's not that easy. So we try to avoid that they have to come just for one appointment. We try to group everything together, but it has to be feasible, and you have to have the same facilities and the same place then, which is obviously not the case in every country or in every hospital. AI is very broad. AI is the hot new thing that is in every area. Personally, I still feel that I have to learn how to use AI better, because obviously it will help us making life easier, not only as a healthcare professional, but also for parents. It will probably help them in finding information easier, so that might be a good thing. But we have to remain vigilant actually in how this field is evolving. That because sometimes you have these fabricated results of the confabulation that AI can do, and so if it's really about healthcare advices, then parents have to know that they're still talking to a computer or an algorithm and not to an actual healthcare provider. So whenever there's a serious diagnosis in IBD, or here when we take care of children with severe neurological impairment, we actually discuss this with parents. So if you go out and start Googling or start asking ChatGPT, what should I do? If you come up with things that you've never heard us tell you before, ask us, check with us. We will always be honest. We will always tell you what we think about it before you can start worrying sometimes, or just doing things that are perhaps not in the benefit of the child.
Друг международен научен форум, организиран в изпълнение на дейностите по проекта за повишаване на транслационните постижения в медицината МУВЕТИМ, който наскоро се проведе във Варна, е 8-ият международен симпозиум по обструктивна апнея и хъркане. Той беше организиран от екипа на научната група по обструктивна сънна апнея и коморбидност в Медицинския университет Варна. А сега да видим важните теми, които вълнуват специалистите в тази сфера.
Today, my topic is the comorbid insomnia if you suffer from sleep apnea syndrome. Maybe you know obstructive sleep apnea syndrome is snoring interrupted with and so in this very moment the oxygen level in blood decreases and makes an alarm in your brain. We call it arousal. So this is why you survive, because then you start breathing again. But this causes insomnia. It means a patient, we didn't know that 10 years before, that patients who have this obstructive sleep apnea syndrome have the same problem as, let's say, postmenopausal ladies who have hormone problems and so on, cannot sleep from that reason. And so we have to address both the obstructive sleep apnea, which is the reason for the problem, but also the neurocognitive challenge which is given by the insomnia, which is the reason for the sleeplessness.
What are the challenges in your field nowadays?
Oh, a lot, especially because unfortunately our population in Germany and in Europe, I'm president of the European Academy of Sleep Medicine, is not only aging but also getting obesity. And obesity is the main reason for obstructive sleep apnea syndrome. Obstructive sleep apnea depends from gender, mostly men, and ladies start after the menopause, the body weight, the age, and alcohol. So you can avoid alcohol, but you will stay a lady, and we all hope that you get year by year more healthy aging. And this healthy aging depends on proper sleep. It is 1/3 of our life and gives you power for the rest. We have this rule, let's say I'm now 173, so I should have 73 kg. Less is better. More is always a big problem. And maybe you heard about these new drugs which help also very obese patients to reduce their body weight, the so-called GLP-1 agonists like Mounjaro and Ozempic and so on. They are not only helpful for diabetes patients, but because this obesity creates not only obstructive sleep apnea, but also diabetes, hypertension, joint problems, and a lot. And if you ask me about longevity, the best is to have normal body weight. First, snoring. And if your bed partner realizes that he has to leave the bedroom because he is afraid of that your husband or your partner or your wife is dying because she does not breathe anymore, and she has this terrible daytime sleepiness, which makes you, then you should go to the doctor and then solve this problem. Will also help a lot of patients to manage their mental problems.
It's a gathering of all over the world, more than 20 faculties. So we are talking about sleep apnea and how the upper airway muscles are collapsing and how they are behaving during sleep and how the people are going for a sudden cardiac arrest actually. So my talk, actually I'm giving a 3 talk regarding actually how the epiglottis and tongue and how the upper airway muscles are collapsing during sleep and how to do a surgery and improve the sleep quality in a young individual as well as an adult actually. Because of the sleep, this muscle tone is decreased, is causing collapse, and sometimes actually during night they used to choke and not able to breathe. So next day morning they used to feel very tired, not able to drive the car, and sometimes so BP is increasing and sugar is increasing, they will go for a cardiac arrest also. So that's why to understanding the muscles of upper airway during sleep as well as during snoring and how we treat them and surgically as well as medically is very important for younger colleagues to know that. That's why we are here to teach them and train them in the field of obstructive sleep apnea, how to improve the results after surgery.
What do you think is the latest news about sleep apnea and snoring?
I'm a sleep surgeon, so we are innovating a lot of technique in sleep surgery. So without pain and without too much of complications, we are doing a simple snoring surgery. The latest innovation is neurostimulation of muscles. So the hypoglossal nerve is responsible for a lot of the muscle, so palatoglossus and palatopharyngeus and genioglossus muscle. So stimulation of this nerve causes contraction of this muscle and open the airway. It's a very simple procedure. This is the latest innovation in the field of snoring and sleep apnea. The challenges are the awareness of the in younger individual actually. So a lot of guys are snoring, they thinking the snoring is because the excessive tiredness, so they are working hard. Because of the working hard, they are snoring at night, but it's not correct. Snoring is a disease because of the reduced upper airway. That's why the snoring is there. So if there is heavy snoring and disturb the partner, and the next day you feel the tiredness and the elevated BP and irritability, headache, definitely you have to consult your doctor, and you go to assess the upper airway collapse, and getting a treatment for that is very important.
How can we separate the normal snoring that happens in life after some age?
Yeah. The snoring, actually we divided into three parts: mild, moderate and severe. The mild is only the sound is there, but actually they won't feel any tiredness the next day morning. There will be no irritability, there is no fatigue, nothing will be there. Suppose people with this heavy snoring is to disturb the partner, so we able to hear the snoring in the next room. Next day morning they use extreme tiredness. Even after good sleep they won't feel the freshness, they want to sleep again. So even the simple resting period they want to sleep, and next day morning fatigability, headache and irritability, and putting a lot of weight. Even though they eat little, they put a lot of weight, it's not able to reduce the weight. All these factors are red signals. So these signals are there, definitely they have to consult the doctor. These are the factors I want to tell them. Don't think snoring is a sign of excessive tiredness and a sign of good sleep. It's not a good sleep, it's a bad sleep. So because the obstruction, only the snoring is there. So definitely you have to consult your ENT doctor or maybe your dental colleagues for very good improvement in your sleep quality.
I know that you're a surgeon, but do you think that there might be some natural habits that we can do in everyday life for prevention?
Is there actually. So eat little and do a proper exercise and do a myofunctional therapy. Myofunctional therapy is a therapy of oropharyngeal muscle to improve the tone of the muscle. So to improve the tone of the muscle, definitely the snoring is less. They can have a good sleep and good life actually. So less diet and proper exercise and proper sleep and do a myofunctional therapy, definitely they can avoid surgery.
I'm a little bit different. I am not a rhinologist, I'm a neurotologist, so I'll be talking about balance and vestibular stuff tomorrow. Balance or vestibular problems, they're not very well known. So our biggest challenge is to take the message to everybody in the world, including the standard population and the peer group, what balance is all about, because it's something there which you just don't care. For example, if you fall on the road, you won't give it a second thought, but it might be a problem. So that's a challenge, and I deal also with specifically balance in children, so that is even less well known. And balance medicine is making huge strides. It is improving, plenty of developments. In fact, tomorrow I'm going to talk about the latest developments, and the challenge is how to take it even further and give the best quality of life for our patients, yes.
Do you think that balance and vestibular problems are more genetic related, or they can be grown up with age?
That's a very good question, because I'm right in the middle of research of this. So far, I would say about 25 genes have been identified which can cause genetic balance disorder, but by and large they are usually acquired. The genetic balance losses are invariably linked to hearing losses, which I deal with every day.
And do you relate some problems with the use of electronic devices also?
That's another fantastic question, because things are coming. Tomorrow, if you're here, I'll show you a video how we have evolved. So first man started with a simple bone as a weapon, but now he's flying to space. That's how we started about 170 years back, and now we are in age of vestibular implant. You have heard about cochlear implant, right? Now we are talking about vestibular implant, which is a reality which is happening. 3 groups in the world are working on it at the moment, and that is an absolutely cutting edge development in our field, yes.
I feel very good being in Varna with my dear friend Mario's invitation. This is the second time actually that was meeting, and we were in a very close area, but today just next to sea, it's fantastic.
What do you expect from this conference?
Actually, the conference is basically on sleep disorders, but me, a couple of more colleagues are invited for vestibular diseases. I'm a neuro-otologist, which means that I'm interested in otology and dizziness problems. So I'm expecting to learn something from my colleagues and try to help them to understand. My topic is vestibular migraine, migraine-related dizziness problems. So I'm happy to be able to share my knowledge on this topic with the colleagues. Sometimes you feel sorry that the patient can't understand basically what he or she has. Try to explain them not only anatomically but physiologically, what happens in the mind, what happens in the ear, in vestibular part of the ear, and its connections with the brain. To explain them is not that easy, but try to make it simple and try to explain them. And when they understood it, and when you show it with your laboratory equipments, it makes me happy.
I want to congratulate Professor Rykov, the rector of Varna Medical University, for this congress and for this excellent program. Also, I want to be grateful to Professor Milkov, the Vice Rector, for inviting me here and arranging all of this excellent program. Varna for me is not a new city, or I don't feel stranger here. I've been in Varna many, many times. I like this city. It's my second home city. And all the colleagues here are my friends and brothers and sisters. So I'm always happy to be here. And every time I come, I notice the excellent progress in everything. And they are going from success to success. So congratulations and good luck.
What are your expectations from this year's conference?
I think because there is a lot of experts from all around the world, from Germany, from India, from Turkey, from Italy, from everywhere. And of course, I'm from Egypt, and the Bulgarian friends are here also. A lot of people are here, and they will exchange their experience in this field of snoring and sleep apnea, which became now a very major problem around the world. It was not so important, but now it became a problem for the world.
Yes, because of the aging population wherever. What are the main challenges for you in your work?
The main challenges is that, I'll say something maybe a little bit funny, that the people now, because of the media and the social media and all these things on the telephones, are now depending on this, not asking the real experts and doctors. They said, I have read this. No, please go to your main doctor. Don't depend on this, because they don't have the infrastructure of the knowledge. That's it. Now, this is a challenge, and especially for the new generations.
I'm very happy to be here. This is not the first time. I have been several times in Varna. Varna is a very nice city, and my friend Mario is a very nice homeowner. Always I like to come here, to be here, and to meet with friends and to share our knowledges. I hope this will be a good conference. I wish success.
What is your topic here this year?
My topic is about smartphones. There are some applications for obstructive sleep apnea diagnosis or treatment. They are not very well, but it's a new era. I think it will be better in future. I just want to take attention on this subject. Patients are not, they don't have so much knowledge about their diseases, and we have to reach them, we have to educate them, and we can help them after them.
I think this is a very interesting conference because join a lot of specialists, a lot of professors, experts in obstructive sleep apnea, in middle ear surgery, and from every place all over the world. So it's a great pleasure for me to participate here because it's a good occasion to learn and to give my experience to the Bulgarian colleagues.
What is your topic this year?
This topic this year I will speak about robotic surgery in the hypopharyngeal collapse in the patients with obstructive sleep apnea syndrome. Challenge for these patients is to make a good diagnosis for them, to give a good surgery, because many times if we don't study the patients in the proper way, we can't do a good surgery. Robotic surgery is fantastic, but you have to do it in patients that have indication for it, not in every patient. Okay.
Do you think that the number of patients of sleep apnea and snoring increase in Italy?
I think not increased. The problem is that now we are diagnosing them. Before many patients just snored, just the married said that the husband snore, but the sleep apnea in many times is underdiagnosed. Now we have the possibilities to diagnose. There is more sensibility about the sleep apnea syndrome, and so many times they arrive because they are sleepy and they want a diagnosis to improve this problem.
Yes, a lot of people think that snoring is normal above some age, and for aging people this is not a problem, but actually when is the first time when a patient needs to realize that he has a problem with the snoring? What is the symptom for you?
Yeah, the sleepiness, this is the first symptom for the patient, because if it's just a snoring, this is a problem for the wife, not for the patient. The problem is when the patient begins sleepy and he has problem like hypertension or other problem that in many times it's a red flag with which he understands that he has a problem.
You're a surgeon, but can you give some advice that we can use in our everyday life to prevent conditions like sleep apnea and snoring? What would it be?
Yes, it's very important to fight the obesity, because this is the problem. In many 80% of patients, they are obese patients. So it's important to maintain a good weight, and because increasing the time, the age, it's normal to be overweighted, but we have to reduce our weight to prevent sleep apnea syndrome.
Майор доктор Недева, каква е темата, с която участвате тази година на конференцията по сънна апнея?
Здравейте! Две са темите, с които участваме. Едната тема е посветена на едно пилотно изследване, благодарение на което сме тук, инициирано от професор Милков с неговото любезно съдействие, на изследване на качеството на съня на екипажа на кораба научно-изследователския. Включиха се 10 доброволеца и се получиха много интересни резултати. Все пак основната е грижа за хората. А втората тема пак е посветена на съня и представяме предизвикателствата за плаването до Антарктида през погледа на участник в самото плаване и резултатите от един тест за оценка, субективна оценка качество на съня, който се нарича Питсбъргски въпросник. Мисля, че ще е интересно за тук присъстващите.
Какви са вашите очаквания от конференцията? Виждаме гости от цял свят, буквално специалисти в областите на сънната апнея, на вестибуларния апарат. Какво очаквате вие като специалист?
Аз очаквам да чуя най-новото, което в момента света предлага, благодарение на специалистите, които са тук, които са доени в собствената си област, и най-вече какво ще е полезно за хората. Дори за мен, като потребител на подобна информация, как можем да опазим най-ценното нещо в себе си, здравето. Ако сънят ни е нарушен, ние не сме работоспособни и няма да успеем да си вършим нормално задължението. Така че освен хубави очаквания, друго няма. Аз съм психолога на военно-морско училище и имам преки наблюдения наистина как се отразява както военната, така и морската среда върху хората. Редица са факторите, които оказват влияние. Например, факта, че ние тук можем да се приберем вкъщи и да починем, да се наспим или да си хапнем с любимите хора, докато на борда на кораба нямаш възможност нито да кажеш, днеска няма да участвам в работата или днес ще се взема болничен. Съответно има и други проблеми, като клатенето, вибрациите, шумът, които оказват въздействие непрекъснато върху слухови апарати, върху вестибуларни апарати, въобще върху цялата личност. Това няма как да не се окаже въздействие върху човека. Повишават се нивата на стрес. Работата на всички, които са на кораба, е изключително отговорна, изключително сериозна и изключително енергоемка. Затова и всички морски специалисти са много добре подготвени, но цената е много висока.